Thank you. Thank you for the opportunity to be on the stage. The authors have no disclosure. So looking at the treatment of rectal cancer, there were two main advancements. It's the utilization of the TME popularized by Alger Hillman 30 years ago, and the adoption of minimally invasive approach in rectal cancer surgery. But when we look at laparoscopic TME, we still have certain doubts about it. The earlier RCTs show a high conversion rate, and the recent two RCTs, that is the ALACAT and the C6051 trial, failed to show non-inferiority for laparoscopic TME compared to open. And many of these RCTs showed a higher rate of positive CRM, despite often it is not statistically significant. And this difference is especially pronounced if you look at just the distal rectal cancers. So clearly, for laparoscopic TME, we still have a lot of room to improve. So some studies show that for robotic assisted TME, there is a lower conversion rate, maybe lower positive CRM rate, maybe better functional outcome. However, I cannot stress too much on these advantages because these are still debatable. And we know that the ROLLER trial, that is the multi-center comparison trial between the laparoscopic and robotic TME, which the results were made public last year, showed that the preliminary data showed there is no advantage in the robotic arm. But however, when we talk about survival outcome, very few papers in the literature elaborate on the survival outcomes of the robotic assist TME. We have been using surrogates like CRM as a surrogate for survival. We expect if you have more positive CRM, there will be more local recurrences and poor survival. So what we do is that we try to analyze our results. We have been doing robotic assist TME since 2008, and this study, the objective is to compare the short-term outcome as well as the survival data between robotic and laparoscopic TME. We have included patients over the past 8 years. We have included patients with mid to low rectal cancers. So we have about 170 patients who underwent laparoscopic TME, and about 220 cases of robotic TME. So interestingly, there were more male patients in the robotic group. And also, there were more patients undergoing preoperative radiotherapy in the robotic group. The rest of the demographics were similar, and the operating time for robotic TME were a bit longer, about 30 minutes longer. However, the conversion rate for robotic TME is less than 1%, which is compared to about 3% in the laparoscopic group. For margin status, there was no statistically significant difference. But if you look at the circumferential radial margin, the laparoscopic group, the positive CRM is 8%, which is more than double. It's about double to that of the robotic group, which is 4%. Somehow the group in the robotic group has more lymph node harvested. And if you look at the other clinical parameters like the mortality, reoperation rate, hospital stay, they were all similar. For the morbidities, the two groups were very similar, except one is the postoperative urinary retention. In the laparoscopic group, the incidence is higher than the robotic group, and that was significant. We look at the survival data of the two groups. The overall survival between the two groups are comparable, both 80% overall survival. The disease-specific survival is also similar. This is the local recurrence rate of the two groups. Both of them is about 5% over time, and it was very encouraging for us because we were able to achieve relatively low local recurrence rate with MIS approach, and it's comparable to the open. and just that there was no difference between the two groups. In terms of different disease stages, there were no difference in terms of the survival outcome. So the limitation of this study is that it's a non-randomized study, and it's retrospective. It could be biased. Some of our patients, the follow-up period was not long enough, and there are certain parameters was not present at some of the cases. So in order to conclude the study, I would like to say that for the two groups, the robotic and laparoscopic TME, they have comparable both short-term and survival outcomes, but that the robotic assist TME, they may have a role of better functional outcome. Thank you very much.